Thank you for coming to our goal setting training this morning. We appreciate your time. We are going to try to very quickly just go through a little bit of what the expectations are for the Emerge initiative, and specifically concentrate this morning on the department goal setting piece of the initiative. So for those areas in which there is a faculty member that reports directly to the dean, part of the one-on-one review meetings this year with chairs and others was a continuation of the process that the dean started last year, where he asked individuals to set goals both individually for themselves as well as for their department and their areas. So if you work in one of those departments in which that is true, the very first thing I'm going to say is to go back, talk with your faculty leader to find out what sort of goals they may have established or may have already submitted to the dean. I'm working with the dean's office to go through and look at what's already been established. For those of us for which that's not the case, we're a little bit more on our own, a little bit more independent in terms of saying, you know, what are some of the goals that we may want to set for our area. So the goal of the Emerge system is that everyone from July 1st to October 31st would take time to set an individual goal, and that those goals would be aligned with department goals, and that the department goals would be aligned with the institutional goals. So we want to make sure that we're all in a good spot to be able to determine what those department level goals should be. So we're going to go through the value of goal setting, talk about, you know, different areas specific to each of our areas of focus that we might be able to set a goal for, figure out how to do an effective and actionable department goal, and then to identify where we're going to go from there after our goals are set. So, and we're going to accomplish all of that in a little less than an hour. So strap on your seatbelts, here we go. So the importance of department goal setting, you know, to some degree this goes without saying, but for us here at MCW, again, much like the performance review process, I think departmentally we've all been at different places in the journey as to whether or not we've been setting goals as a department and communicating that out and letting everybody know about it, or whether or not it's just been more of an individual process, employee by employee. So back in February, the president rolled out for us at the town hall the institutional goals that we have, and that's really the first time in at least a very long time that MCW has really had kind of a compass, if you will, in terms of where are we going organizationally, institutionally, what direction are we saying we're moving in. So now that we have those institutional goals, we realize that it's really important that as departments, we take a look at where are we going, and how does that direction line up with the direction of where the institution is going. So in other words, in each of our specific areas of focus, what are we doing that, you know, best supports where the organization says that it's going? And so that's where we as leaders come in our areas to really be able to say where are we going as a department, and then help to educate our faculty and staff about where that direction is and how that aligns with where the organization is going overall. I've said this in many conversations that I've had with some of you in the room and others, that the resounding theme from both the Faculty Forward and the Staff Insight Survey was, I don't understand how my contribution and or the contribution of my department lines up to the contribution of the institution as a whole. So I love working at MCW, I love what I'm doing, but I don't understand how I'm moving the institution forward. And so that's really was kind of the birthplace of this Emerge initiative, and one of the big things that we really want to be focusing on. So for those of you for which setting department goals are somewhat new, you know, we're really recommending that you start by doing somewhat of a SWOT analysis, taking a look at what's going well in the department, what are some areas in which we need to do better, and each of you will have different metrics, different pieces of data that you will use to determine what's going well, what isn't going well, what opportunities present themselves, particularly as we look at the institutional goals and the direction that's going. When you look at what it is you do in your area, what opportunities are there to support those institutional goals, and then, you know, what are some of the threats that exist. So for those of us that are in clinical and basic science departments, we could probably do this real easily in about the next 5 minutes. We're all pretty familiar with what some of the opportunities and threats are. For those of us that are in more central administrative areas, I think really taking a look at what are the overall opportunities and threats to the organization as a whole, so reduced funding, market share in the clinical area, and how do we, as central administrative areas, best support where the organization is going, and how can we help our customers that we serve. So I think coming together with leadership in your department to do a SWOT analysis can help bring you to the place of what some of your department goals should be. We also would suggest getting employee input, so pulling your staff together and maybe doing this SWOT analysis, taking 45 minutes to an hour, doing a SWOT analysis as a group and saying, okay, you know, what are some of the things that we really need to be thinking about, and hearing from your employees. You know, one of the other things that we heard loud and clear in the engagement surveys was we want to have more dialogue. We want to have more input with our leaders. So I think even in the department goal setting process, this can be an opportunity to really pull the group together and engage in dialogue. And then finally, if you feel that this might be more apropos to your area, we certainly have a lot of retreating that we do. And I mean that in the positive sense, not the running away. So you may want to hold a retreat with the leaders within your area, and again, do a real deep dive into where have we been and where do you think we should be going, understanding the current climate. And you know, remember that the ultimate objective of all of this is really to come out with 1 to maybe 3 department goals. You know, we're going to suggest that you really shouldn't have more than 3 goals. We're asking for a minimum of 1, but it's awfully difficult to concentrate and really sort of move the needle on anything when you have, you know, 10, 15 goals. So we have some very eager folks here at the college that have been setting a lot of goals. So I'm just going to advise that you probably want to do 1 to 3, concentrate on some big areas, and do those well. So other things to consider as you begin to look at this whole goal setting process, we've talked a little bit about this in terms of the SWOT analysis, but these may be some actual questions that you'd want to put in front of your employees or your leaders as you sit down and sort of do this. You know, where is the department heading? What results are we achieving currently? This really goes to, you know, what are we doing well? And what are some of the metrics or those pieces of data that you might want to pull together to really take a look at that? Where do we want to improve? And what is actually attainable with the available resources? So one of the things that we're talking about as we look at the training around the individual goal setting, we've been talking about making them simple. Okay, simple goals. And what that really means is, you know, measurable, important, realistic. We know that we are all, no matter what area we are in an environment in which resources are tight. That is an environment that is not likely to change anytime soon. So as we take a look at where are we heading, what do we want to accomplish, really making sure that we can accomplish these with the resources that we know are going to be on the horizon, I think will be really important. Okay? So some areas that you may want to take a look at, projects, quality, service, enhancing efficiencies. We've had, quite a few lean efforts going on. I just met with the MCP practice yesterday, and they're actually putting a lean team together that's going to go out to departments in 2 areas to really help them address clinical efficiencies. So that may be something that you'd want to take a look at. Fiscal performance, employee engagement. A lot of us put action plans together after we did the faculty forward and staff insight surveys. It could be that there's something on that action plan that you're really going to set as your department goal for this year. You really want to enhance employee engagement in a certain area. That would be a great goal. Many of you have already been working on things over the last year, so it may be just taking one of those items and refining them or taking it to a next level, and that's going to be your department goal. Could be some things around workforce planning as well. What types of talent do you need? What types of services do you need to be providing? And what would that look like? How would that change the way that your area is constructed? So a couple of different types of goals. I think this is something to think about not only as you're looking at developing your own department goals, but as you sit down and begin to work with your employees around their individual goals. We talk about 2 different kinds of goals: stretch goals, opportunity goals. We're really going to be encouraging departments to look at stretch goals, things that kind of cause us to go a little bit above and beyond, things that get us out of our comfort zone a little bit. I think the old saying about human nature is really true, that we tend to rise to whatever level is expected of us. And so we're really hoping that through this department goal setting process, we're going to be setting goals that will help all of us rise to a new level. So aggressive but achievable. And I think if there was one thing that you sort of walked out of here today with in terms of the theme of the department goal setting, is we want to set aggressive goals that we can actually achieve, okay, within the framework of some of those things we talked about the slides earlier. And then opportunity goals, again, talking about, where are some areas we could improve. All of us have, or I should say most of us have, metrics, things that we measure ourselves, benchmark ourselves against in terms of how we're doing. I think those can be a really great place to take a look at what we need to be doing. And then those that might be recommended for essential areas. So what are some of the core functions, fundamental pieces that we're responsible for in our area, and are those things going well, or are there goals that we need to set to try to make those a little bit better, enhance those a little bit? So as I look at some of the areas that I'm responsible for, in human resources, we do a customer service survey. We also do one in the Office of Faculty Affairs. We also have customer service standards that we've set in terms of turnaround, and we track all of that. So as we look at setting department goals, those would be some of the metrics that we're pulling together to say, how are we really doing? And are there adjustments that we need to make in that? We've also put together a document that really goes through kind of the major initiatives at the college that we're responsible for. And we're taking a look at all of those projects and coming up with, what are some of the themes from that? And then looking at setting goals from that. In our particular instance, we're looking at setting goals based on the roles that people play within the department. So if I were to take something like, let's say, the zoo interchange project, and how we think that might affect the recruitment of employees to the medical college over the next 5 years. My guess is that there are going to be some very specific sort of market-sensitive jobs where I could go to any healthcare system that people may say, I don't think I want to put up with the zoo interchange madness over the next 5 years, so I'm going to, go look someplace else. So I may have goals set for my recruiters that are going to be around that project. They're all going to have the same goal, and we're all going to be focusing on the ability to continue to attract top-level talent in the midst of that threat that we have coming before us. I might be in a clinical area and I would really want to be focusing on time to next appointment because we have an issue there, and everyone in my department can impact time to next appointment. So I set a department goal and we're all going to focus on that for the next year. Our critical thing is going to be to try to get our time to next appointment down to 30 days or down to 2 weeks or something along those lines, okay? So I think as we approach this, the more that you can be thinking about department goals in which everyone has a piece that can contribute, the easier it is going to be for people to really kind of resonate and figure out how they align to that goal. You may find that as you take a look at it, you're going to have a particular focus or goal for faculty and maybe a particular focus and goal for your staff based on how they contribute. But I think the most important piece of what you can do in all of this is really sort of that SWOT analysis and that dialogue to say, where are we headed? And what do we really want to focus on over the next year? What is something that the individuals in my area can really, grab a hold of and say, this is where we're going. This is what we're focusing on. And what are those 1 to 3 things that we might be able to do? So, Catherine, are you going to walk us through the next exercise now? Or am I going to do that? First time, sorry.
Well, what we have is, we thought it might be worthwhile while we're on this topic and it's fresh in your mind to take just a couple of minutes here and start to brainstorm. We're on page 9 of your packet. How you might go about saying, well, I'm sorry, it looks like you have a strange version of your packet. There you go. Thank you. And brainstorm some of the responses to those questions there that will help you lay the groundwork for starting the goal setting process for your department. So why don't we take probably about 5 minutes here, and you can work independently at your table. We're happy to answer any questions.
Sorry. All right, so hopefully that was helpful in beginning to at least get the juices flowing around directions that you might want to go. Love this quote: in the absence of clearly defined goals, we become strangely loyal to performing daily acts of trivia. I remember years ago I went to a Stephen Covey seminar, and he's got the 4 quadrants that you sort of focus on, and one of those really talked about how we sometimes allow the trivial, urgent things of the day to take us away from that which is actually most important that we should be focusing on. And I think that's probably one of the biggest values of goal setting, is it allows us to really kind of, hopefully, if we use goals correctly, helps us to continually sort of reset and go back to that place of, wait a minute, what's most important. I think oftentimes, I don't know, maybe I'm the only one, but the volume of email and phone calls and questions and things that come in the course of just one day can oftentimes derail us from getting at where it is we really want to go. So being able to set goals, and then Catherine's going to talk to us about how we align and keep them fresh, but keeping those in front of ourselves and in front of our employees, I think, can be one of the things that can really help us make sure that we don't get too caught up in the daily acts of trivia, so that a year from now we look at each other and say, yeah, remember when we went to that goal setting class with Kim and Catherine, and these were the great things that we were going to do. We're hoping that, again, setting 1 to 3 really specific and important goals will help us all really accomplish it. So this goes to what I had alluded to earlier, which is the method of goal setting that we are adopting. Many of you are probably familiar with the SMART goals. I would say simple goal is very, very similar to the SMART goal concept, the whole idea of being very specific. So oftentimes, and I think particularly when we're talking about department goals, it can be easy to get lost in some really big sort of lofty kind of a thing, right? Institutional goals, we assume, are going to be rather big and lofty, right? Those are sort of our goals, our values, the big picture of where we're going. But when we start to look at things at the department level and then at the program and individual level, this is where we really need to get specific, concrete. What are we really talking about? Not just like, we are going to make sure that our patients really like us. Okay, but we need to get really specific. We want to enhance our patient satisfaction scores by 5%, I don't know, whatever's realistic for the area that you're in. So specific, what are we going to accomplish? And we're going to increase those patient satisfaction scores by, okay, and then filling in that blank in terms of what that might be. Important. So I think that, no pun intended, this is probably the most important part of the model, because we can set goals around just about everything or anything. But what we really want to be setting goals around is that which is most critical and most important. So that goes back to that SWOT analysis, that goes back to where are we heading, what do we really want to accomplish, and make sure that we're setting goals around that. I will tell you that as leaders, as you are interacting with your employees, I think important is really important. I may want to take an Excel class and learn how to do pivot tables because I think it would be really cool. I saw someone use them in a meeting and I think they'd be really cool to know how to do. But is that really important? Is that really moving us towards where we're going in the direction that we're going? So I think if there's anything in here that we're really focusing on, this is a key one, especially when we're talking about 1 to 3. Right? If we were setting 10 or 15 goals, I'm not sure it would really matter. Let's just throw a bunch of goals up there and hope we get them. But if we're doing 1 to 3, we got to make sure they're the right ones, and then they need to be measurable. We need to be able to come back together a year from now, sit in this room, and say, Kim, here's how we met the goal that we set. We know this by X metric, or the fact that this happened or that happened. Okay? So, usually a specific goal will answer the W's. What are we going to do? Why are we doing it? Who's going to be involved? And then there might be a where There might be a location or a program or something specific that you may put in there as well. But I think as you're actually looking at writing this, even putting that out for yourself, what, and then answer that question. Why? Answer that question. Who will be involved? Okay? So, as sort of an example of, improving internal department communication, right? That sort of falls in that category of probably too general, okay? It's a good goal. Again, if we look at our engagement surveys, that came back loud and clear that people didn't think that there was good communication sort of throughout all levels of the organization. But a better goal might be we're going to improve department employee engagement through increased two-way communication, as evidenced by increasing scores by 2% on the next employee engagement survey. Okay, we're hoping to run another employee engagement survey this year, so I think that's a valid metric. If employee engagement is one of the things you really want to look at in your department, I think we're going to run another one, so that would be a good metric that you could use. All right, so we get the idea, right? You really want to be able to build your metric right in there and have it be very specific. And it still needs to be realistic. So you realize I didn't say we were going to improve engagement by 15%. Right? Okay. In a year, the things that we've done in our areas to improve employee engagement, you're not going to see, an increase of 25 percentage points. It takes a lot to move that needle. So you want to be able to do something that's really going to be realistic. So if a goal is important, we talked about this, again, some questions that you might want to ask yourself to sort of test. Have I really written an important goal? Is it worthwhile? Is this the right time to do this? So this one, we've been, again, going through this exercise in the Office of Human Resources, and we put 10 things up. 10 major initiatives, 10 big things that needed to happen as a starting place to begin to say, okay, what of this now do we need to flesh out into our goal? And this question, is this the right time, actually took about 4 of those things off the list. They are good things to do. They are things we will likely need to do at some point, but the current context, the current environment, the other competing things that were up on the list that need to be done, knocked some things out and said we'll put these up again next year and see if they might be the right time. And then does this match MCW and your department's other efforts, where we're going? Again, it goes to that whole alignment thing. Or are we just off doing something that sounds really cool but doesn't align with where we're going? I will say that I think, again, as leaders, that will likely be your challenge as you work with some of the individuals. You're going to have a couple of different options. One is to really sort of tell your department this is what we're all going to focus on and push that goal down. The other would be to have individuals write their own individual goals, or you may have people do a little bit of a mix of both. But I think in terms of the match piece is probably the most challenging when you allow employees to write their own goals, okay? Because sometimes they come up with some really cool things, but they're just not at all in the direction of where we need to go. All right, so a measurable goal will usually answer these questions. So again, as you're sitting down and you're looking at crafting your goal, I think these are just very practical questions that you can put out. Okay, how much, how many, how will I know I was successful? Okay, so the old adage, what gets measured, what gets done. So a measurable goal is either going to be quantifiable in some sense. Okay, in the communication example I said, increase by 2%, or there's going to be some sort of frequency in there. So if we go back to sort of the patient satisfaction piece, maybe for all of the frontline individuals that engage, who are the first engagement, maybe it's going to be that with every patient, they're going to smile, greet them, and ask them how their day is, and then every patient that comes out, they're going to ask them how their experience was. Okay, so some sort of frequency that you put in there, or it could be some sort of quality metric, okay, according to guidelines, according to customer service standards, according to whatever it might be, okay? So we're now going to begin to talk about how we really best facilitate this whole alignment thing that we've been talking about. How do we make sure that the institutional goals, the department goals, and the individual goals are aligned? So Catherine's going to take it away for that piece of it.
Yes, I'll trade it for that.
Okay.
So as Kamara mentioned, what we're going to do is focus just a little bit on the goal alignment, and I think that you probably understand what it is we're referring to, but what I want to do is bring that to life for you and talk to you about how that will then trickle down to the employee level, and especially in terms of the system that's going to be rolled out to support this initiative. So, but what we want to do after we've brainstormed the goal, we've maybe done a SWOT analysis, we've started to think about how we want to approach this goal, what it'll look like. Now we need to identify, if we haven't already, what is the broader organizational goal that this goal of mine is going to support. That goes back to what Kamara's been talking about, how employees would like to see how their contributions roll up to department goals and the institutional goals. It also goes to what Kamara was talking about. She mentioned Stephen Covey, and one of my favorite quotes of his is, "Don't prioritize your schedule. Schedule your priorities." If we know what's important to the organization and employees know what's important to our department, then we're all rowing in that same direction rather than those daily acts of trivia that seem to maybe be more enticing or may seem more important but aren't. So we heard from the president and the dean recently with the institutional goals. I won't read them each to you. You've got the packet there. They're certainly posted in other areas, including InfoScope. But what I like about the goals is two-part. First, it gives employees a vision for where the institution is focusing. And I also like that as you read the goals, you can see that some of them, most of them, incorporate several different areas of the mission into one goal. It really helps to see how different areas of the mission line up to one particular goal for this organization. So this is an example here that we have drafted, realistic or unrealistic. It's intended to illustrate for you how the goal alignment will work, both in terms of the system. This is not a system screenshot, but how the employees will view the written text of their goal, the departmental goal, and the institutional goal. So there's the institutional goal to be the premier provider for the patients. And we have a department that set a goal of increasing avatar scores. We can see that it's measurable by 10% and how they're going to accomplish that. And then we have faculty and staff that have written their own individual goal. In this case, this individual stated that they're going to greet all patients by first name, with a warm smile, elicit feedback. Is there anything else I can do to help you? All those things to try and help support that departmental goal. And in the system, and hopefully through conversations with their leader, also understanding how that supports the organizational goal. To provide you with an example that would be outside of the clinical area and more in the research side of things. Differentiating ourselves through transformative research is the institutional goal. And here's a department that has set a goal of increasing percentage of 60% funded by 10% through the implementation of grant writing. I don't even know if those are realistic numbers, but it gives you a feel for measurable. And then there's an employee here who's going to network with 3 experts nationally who are highly funded to seek collaborative opportunities and mentoring. Employees could set goals that'll support that in any way. These are just examples that'll show you how we take that broader institutional goal that seems so broad and it drills down into that employee's day-to-day contributions. On the screen here you see a template, and I will follow up this training with an email. It didn't do me any good to give you a paper copy since there wouldn't be enough room on one 8.5 by 11, but of how you can go about perhaps once you've brainstormed your goal, you've started to think about what it'll look like, you can start to think about what are the resources I need in the time frames. What is it going to align with? What will be my success indicators? How will I know if I've achieved this goal? That helps you as a leader and your employees to understand exactly how you're going to achieve that goal and how you'll know when you've gotten there. The other way that this comes in handy, and we'll talk a little bit more about this later, is keeping that goal fresh. And it often happens that things do change throughout the year, revisiting how you came up with that goal and what your vision looked like at that time is a great way to decide whether you need to change that goal or whether you just need to change how you plan on accomplishing that goal. We'll talk about that in greater detail, but it is nice to capture what is it that you had in mind when you drafted that goal here in June or July of 2013. When it's January of 2014, that might come in handy. Are there any questions so far on what we're talking about with the goal alignment or establishing which institutional goals we're supporting? Okay. So what's the timing for goal setting here? We're down to the wire at this point. And so I don't have a solid deadline. I just want to give you some food for thought. So beginning in July 1st through October 31st, the goal of this Emerge initiative is that each employee, faculty and staff, leaders, everyone, will have at least one goal. And as we've been talking about, employees will align that goal with a department goal. Now, having your department goals still in the works doesn't mean employees couldn't be thinking about what their goals will look like, what they want to accomplish for that year. So I'm not saying that July 1st is your deadline and all work stops if you don't have your department goals by July 1st. But it is nice if employees know which direction you're focusing on as a leader as they're drafting their goals. All of that is to be concluded by October 31st. So although it's not ideal, quite honestly, if you really had some obstacles to overcome in establishing your department goals, and we're talking about August, September, we're happy to help partner with you to make sure that it's a quality goal. It's not just cranked out as quickly as possible for the sake of process, but it's actually really helpful to you and your employees. And the Office of Human Resources is happy to enter those into the Emerge system. If you provide us with your department goals before July 1st, before we go live with that system, we'll be happy to upload those in there for you. So another piece of food for thought. Any questions on this part before we talk a bit more about employees setting their goals and aligning with yours? Okay. So, you have, at this point, done some analysis towards setting your goal. You've established the goal itself, and you've documented it in a format that's specific, important, and measurable, and you've aligned it with your institutional goal. Now what? What's missing from this path? What do you do next? Cameron, what would you do?
Department goal.
Oh, okay. Well, yeah, you'd do this with your department goal.
Then you set the individual goal.
You'd set the individual goals. You're exactly right, and that's where I'm going with this. Thank you, Cameron. I picked on you. You're a good trooper. We want to communicate with our employees so that they can set their individual goals. We want employees to know where are they going with this goal-setting process. Where is the department going? Even if we didn't have employees setting their own goals, what's your priority as a leader? So who do you want to communicate with? Make sure that you're communicating with your leaders. Executive leadership wants to know what each department is focusing on. All of your department employees. And that can be tough because I recognize most departments, very few, have any meetings where everyone's in the same room. But think about different avenues. Posting it on your InfoScope site somewhere. Sending that link out to the group. Presenting these department goals at any meetings that you might have. What I'll do when I email you that goal development sheet is I'll also email you a PowerPoint slide deck that we've been distributing to leaders that they can use to present the Emerge initiative and their department goals to the employees. Any relevant stakeholders? Is there anyone else that has a hand in wanting to know where your department is going, what goals are set? And then, of course, let the Office of Human Resources know at some point. We have consultants that are assigned to you. Let us know where you're heading with that, and we'd be happy to help support you. As Cameron mentioned, then we want to have employees align and set their goals. I've got a little comic strip here on this piece of it. So this is goal setting gone awry here. We've got employees that are going to write their extra bonus into finding bugs in the system by creating bugs. The reason I throw that up there is it's not always going to be easy, simple. It seems pretty easy when we package it up in this nice, little sample, but you'll have employees that maybe just don't quite understand where we're going with this, or maybe their intentions aren't so mutually beneficial. We have a course on employee goal setting. We have a course on career discussions. We have consultants and training courses here at the college on difficult situations. Has anyone ever taken Crucial Conversations? Okay, Jean has. It's a great course. It's a considerable time commitment, but it's not a one fix. It's learning a whole set of skills for holding difficult conversations. They're helpful everywhere, not just at work, but I probably use it in my marriage more than anywhere. So so there's a whole set of resources out there. There's the Emerge website. If you need any help, you have consultants assigned to each department that are happy to partner with you. You're not alone in this, but I am going to talk a little bit about partnering with your leaders, your employees, to set goals, just to give you some tools to walk out of here with today. So what I want to point out first is the answer to the question, who's best suited to set a goal? The employee or the leader? And we're talking about employee goals here. Well, it depends. There may be situations in which a leader wants to set a goal for an employee or a set of employees. Kamara mentioned earlier the increasing of avatar scores and how everyone could maybe do that by reducing the time to see next patient. So a leader may set a goal that spans a group of employees and assign that to them to work on. On the flip side, employees can set goals for themselves that they will then submit to the leader to review and make sure that they're mutually beneficial. It can go either way, and the system will support that. Just to bring this to life in an example here, so here we have a leader who's going to decrease patient wait times by 3%, and they're aiming to increase their patient satisfaction scores. So they have set one goal for four separate employees to reduce check-in time by 1 minute by December 1st. The leader is assigning those goals to those 4 employees. Now, the system will support that, but I don't want the system to be a substitute for that conversation. We would certainly encourage that leaders are talking with employees about this as it's happening. It's just not an alert that pops up in their mailbox one day saying, here's what you're going to be working on. But the system will support you, and that can be a really nice way to get everyone rowing in the same direction. On the flip side, and you may have a combination of these two, employees can set their own goals. They will still align with department goals. These will still align with department goals, but this one may choose to learn how to do purchase orders to back up the office assistant. This one may be securing more grant funding. This one may be sharpening pencils 10 times faster. I don't know, but each employee could set their own and submit to you for review.